Hello and welcome to the Digital Health and Wearables series, another fantastic episode for you today. And today I'm very privileged to have Erik Gerritsen, which is the Secretary General of Ministry of Health, Welfare and Sport of the Netherlands. So, Erik, how are you?
Well, João, thank you. I'm fine. I'm a little bit busy, fighting the coronavirus, but thank you for the distraction.
No problem. Look, I know I don't want to mention sad things, but I want to give you my personal condolences for the news of passing away of your dad, which
Thank you.
I saw last week. He had a fantastic life, I believe.
Yes.
So, yeah. So I want to talk to you. I've been following your great work, and the Netherlands is very up to date with all the digital health stuff. And in here, I'm trying to build like a think tank global knowledge for us to learn from each other. So my first question for you, Erik, would be
Yeah.
how do you describe the state of digital health in the Netherlands?
Okay. Well, thank you for this great question. Well, the main goal is the right care at the right place, and this means also, of course, right data in the right format for the right person too. And well, for the past 5 years, our ecosystem approach created a very positive climate for digital health. Digital health solutions can most times be reimbursed now, can be part of contracts with healthcare insurers as integrated part of regular care, just like traditional face-to-face solutions. And with a thriving and open marketplace for digital solutions, with many innovative healthcare providers willing to invest and experiment. And we show that proven, effective, and working solutions are now available and ready to use and actually being used. And we also work on supportive measures when it comes to awareness, guidance, digital skills, very important for professionals and patients. And of course, implementation support, because implementation is the real challenge. So, however, the current system to pay for performance is not always helpful to make the required transformation of the healthcare organization in practice. And this is a central point of attention in years to come. And also, this positive climate needs, as you know, if you heard me talking before on other occasions, it also requires fertile ground. So we invested 500 million euros in making health data flow between professionals and patients, between professionals and to patients. And we're working on fundamental trust services for digital identity and authentication and consent management. And also work on other guidelines for quality and safety through frameworks for health apps, wearables, and other medical hardware and software. And last but not least, a new legislation that will make digital exchange of healthcare data mandatory. So it will become part of the definition of quality of care. So not everything at once, of course, but based on use cases with an actual need and impact in the lives of patients and doctors. And I think 2021 will be the year of truth for digital health in the Netherlands. And for the past decade or so, we've been hearing about this promise of digital health as integrated part of solutions to many of our problems in increasing quality of care, access to treatments, improving patient safety, reducing users' administration for professionals, reducing unnecessary costs, improving efficiency, and whatnot. And today, the pandemic forces us to massively turn to these digital solutions. And during the pandemic, our focus has shifted to digital healthcare where appropriate and possible, face-to-face where necessary. Among others, we stimulated, for example, this through extra funding mechanisms for stimulating e-health at home. And as a consequence, we had to fix some of the legal and technical gaps in our healthcare system. So what I always like to say, we didn't waste this very bad crisis. So like the lack of, for example, like the lack of registered consent preferences for COVID-19 patients, admitted to the ICU. And there's now, I believe, a strong focus on providing digital support for the public health authorities in their work to stop the spread of the virus. And in only a few weeks, the Dutch primary care providers were able to shift from face to face to a digital first approach using digital health solutions like remote monitoring, video consultations, and digitally delivered self-care. And a survey done by the Naval Research Institute among GP practitioners shows that 3 out of 4 general practitioners now have deployed new e-health solutions. And today, 85% of the GPs are using e-consults, and this increased from an already impressive 68% in 2019. And 72% of the general practitioners have started using video consults to enable contact with their patients. And 64% of the GPs are first-time users of this technology, again, thanks to the bad crisis. And of course, use of these telehealth services was necessary to provide alternatives to face-to-face consultations that were no longer possible during the lockdown. And interestingly, a follow-up survey notes that fully 90% of GPs say they want to use telehealth, keep on using telehealth solutions more in the future. And some providers are already rebranding themselves and becoming digital first, and more professionals and professional associations are calling for a shift towards digital first as the default approach for healthcare delivery. And at the same time, we saw the trend for the majority to lean back to traditional organization of healthcare after the first wave. And given the shortage of professionals and other challenges, we cannot afford this during and after the COVID-19 crisis. But then, luckily, again, there came a second wave. And again, we were in the opportunity to not waste this bad crisis. So therefore, end of 2020, we initiated an extra speeding up impulse for digital and hybrid organization of health and care together with all stakeholders. And end of 2021, I think scaling up of digital and hybrid organization of health and care should be and will be the norm for all hospitals, GPs, and other healthcare providers.
No, that's fantastic.
Yeah, short questions, long answers. That's a bit of my, that's the way I like it.
There's so much in there. It's fantastic. You mentioned the wearables, the remote monitoring, your policies. I mean, I've been following your work for quite some time. And Erik, we met in Amsterdam in a Health Week conference back in 2016, as you know, with your previous health minister. And you had a very strong agenda back then. But I do agree with you that for many years we're talking, but now the implementation is taking a different hold. And now I know that you
stopped talking and we started walking.
Yeah. And I know that you and Hugo are doing great. Your minister is doing great work pushing this agenda forward. And my next question, moving on, it is so much in there. I know that you have a very strong approach and focus on digitization in health. And recently you created that legal framework to exchange health data and medical data quickly to all the stakeholders benefit from it. So tell me a bit more about that, please.
Okay, I will. Well, as you know, we take the people-centered healthcare very serious here in the Netherlands. And this also means giving people the tools to manage their own health data. And there's a law since July 2020 that patients have the right to a digital structured copy of their own medical data. But what if you as a patient get all your data? How do you store it safely, share it with anybody to your choice, connect it to your apps and services? And for this, we created, I think you will refer to that, to the MedMy Trust Framework, the Medical Me Trust Framework. And it's not more, but it's also not less than a set of rules that service providers need to follow if they want to offer data services to patients and healthcare providers. And rules like how you ensure that the data is actually about that patient, or that it comes from the right doctor, or that data is transported safely and no one else can see data. And MedMy is about using technology to expand the trust relation between you and your healthcare providers. And there are now over 30 personal healthcare service providers who have been certified within the MedMai framework. And currently, the number of people who are actively using MedMai certified personal health data service is still small. Also, of course, the corona crisis led to some it slowed down the implementation process a bit. But on the other hand, because trust is essential, MedMai is rolled out in a controlled way. Small steps to show it works and is useful. And of course, as you know, if you take a lot of small steps, then you really create big progress. So due to the pandemic, the rollout has slowed down a bit, but its need has only increased, and several government incentives programs to enable data to be freed from the silos are now actually in place. And also here we invest over 100 million euros for our meaningful use, for a kind of a meaningful use like program. And these programs are accelerating the use of standards for the digital exchange.
Fantastic, fantastic. And I've been following your great work. One last question. I mean, it's so much information. I know you're doing great work. I've been following your great work also, Erik, in the elderly care sector. And can you highlight some elements of your strategy so other governments can learn, and also all of us in the digital health sector can learn from it, please?
Yeah, sure. Well, first of all, a lot of what has been addressed in the earlier questions also, of course, also applies for the elderly care sector. And as part of the right care at the right place, we take the functioning of people, their life journey, and integrated care in networks as a starting point, and not where and by whom care is provided. And with positive health as a relevant paradigm, looking at what people and their social network can do themselves, and supporting autonomy. And in that perspective, the integration of digital health solutions like wearables is an integral part of the support of healthcare and well-being. And next to the earlier mentioned initiatives, adoption is also stimulated as part of programs like longer at home and at home in a nursing home. And high-level agreements with different sectors and on prevention are also put into place. And a concrete example is the Stimulating eHealth at Home funding instrument to stimulate implementation, integration, and uptake of digital health solutions as part of regular care and support, and try and aim that to make it possible for people to stay at home longer and prevent them going to a nursery house. So this funding program could be scaled up very quickly, again, thanks to the COVID-19 crisis. And at the same time, the main road for adoption and scaling up of digital health solutions is treating them as an integral part of regular care and support, and not as something special. So digital healthcare is regular healthcare. So maybe we should get rid of the word digital and just talk about it's better care.
Oh, fantastic. Integrated care. I mean, that's fantastic. Erik, one very last thing. I finish my episodes with a minute of fame, if you like. So you can give a shout out, anything you wish, really. Professional achievement, personal achievement, refer anyone else, talk about anything. So to finish off and round up the interview, over to you.
Yeah, well, maybe besides that, I'm a very proud granddaddy already 4 times, because my twins, my 2 daughters, gave me the gift of 2 grandchildren each the last 3 or 4 years. So in a relatively short period, and I'm only 58, I became a granddad. But that's not a personal. That's a gift more than anything that I achieved myself, other than being part of making 2 great children, and who now turn out to be great mothers. But so let me just focus on some practical wisdoms, because the people who heard me talking before know that it's that my hobby horse is that it's all about implementation. It's about change management. And maybe let me finish then with two personal practical wisdoms. First is people don't do what they hear you say, people do what they see you do. So again, stop talking and start walking. And if you want to really make a change, then start, whether you are a director or a professional or a patient, make first steps yourself and others will follow instead of keep talking. So people don't do what they hear you say, people do what they see you doing. Very important. And another one, I think in change management, healthcare is complicated. Change in transformation in healthcare is complicated. And people who are passionate about a change, most of the time already have the competence of, taking care of yourself and of your business. But there's another, and that's important. But there's this other competence that you need to be successful in transformation in healthcare, and that is ask for help. And that's a tough one. It's a tough nut to crack, but ask for help. It's complicated. Nobody can do this alone. Not a politician, not a director of a care organization, not a healthcare professional or a patient. We need each other on all levels. So very important, still undervalued and maybe even underdeveloped competence in making a successful transformation in healthcare possible. Ask for help, people. And be amazed about how many people are willing to help you.
Eric, what can I say? Fantastic. So, to round up, two very powerful points. Do take action, the others will follow, and also ask for help. I like that because you finish the episode in a very powerful way, giving us all a bit of a push to do things right. Erik, I know you are a busy individual. I feel privileged. Thank you so much for giving me some of your time and
You're welcome.
this fantastic interview that our followers and our viewers will benefit from it. I want to thank you all for joining. Also, subscribe to the channel. And to finish off, I wish you a happy new year and that the COVID goes away. And before I finish the episode, I want to acknowledge our sponsors, our global partner, Spirit Digital. They're doing great work with remote monitoring. You can check them out on the channel. Erik, once again, thank you so much.
You're welcome.